So Braden Diabetes Center is the American Diabetes Association recognized comprehensive outpatient facility of MarinHealth Medical Center. We offer state-of-the-art diabetes self-management education, which is accessible, patient-centered, and meets the needs of our community. We offer a broad range of innovative services and support for our patients, their families, and caregivers to effectively manage diabetes and pre-diabetes.
Braden Diabetes Center is so unique in the comprehensive services that we're able to offer to our community, both in the outpatient setting and the inpatient setting. We have a full scope program that includes the transitions of care, which a lot of programs probably don't include. So often our clinicians are able to see a patient during their acute phase when they're hospitalized, maybe a new diagnosis of diabetes, type 1 and type 2 often, and then we transition as outpatient at the Braden Diabetes Center, and we're able to continue providing care for that patient in their journey with their diabetes diagnosis.
What makes the center so special? I think the team-based approach is certainly very helpful. Patients really do enjoy meeting with a nutritionist, as well as having a team that really cares about, their insulin levels, their blood sugars.
I got involved in the Braden Diabetes Center 20 years ago, before it was even here. And my doctor, Dr. Linda Gaudiani, and I decided that it would be really good to have a diabetes center in the county of Marin. There was a lot of demand, and it was difficult to find the number of endocrinologists like today. So we drafted a business plan, put it in front of the hospital, and we started the Braden Diabetes Center. And it's been great for the county, and it's been a real pleasure. And good news, bad news. The bad news is that the demand continues to go up. The good news is that we have the BDC here to assist people.
We are looking at various innovative ways to partner with our other specialty colleagues like cardiology, ophthalmology, podiatry. We also work really hard to make sure our educators, our staff are up to date and trained in the latest technology for diabetes. And then we are also looking at different ways to partner with other specialties, facilities, companies, as far as advancement in research and development goes in the field of diabetes.
So with regards to the Braden Diabetes Center, we've actually been very fortunate to offer a new pathway of care where in patients that have perhaps metabolic syndrome but not overt diabetes, or in patients with polycystic ovarian syndrome where their cardiovascular risk factors are affected by their hormones, or patients who are premenopausal or postmenopausal where their cardiovascular health is affected by their hormones, we actually have been able to start a pathway collaborating with the Braden Diabetes Center using continuous glucose monitoring.
So there has been a lot of research and development which has happened in the field of diabetes in the last couple years, and this era has been extremely exciting. So we now have technology like continuous glucose monitor and insulin pumps, which help not only optimize blood glucose control for our diabetic patients, which reduce the complication risk, but also lessen the day-to-day burden of living with diabetes. We also have the closed-loop insulin pumps, whereby there is an inbuilt algorithm which helps titrate dose of insulin based on blood sugars. So our Braden Diabetes Center, we have our certified diabetes educators who are well trained to handhold the patients who are new to technology because it can be overwhelming. And we offer a new insulin pump starts and upgrades of insulin pump training as well at our center.
I think the future of the BDC is very bright. I think that we will continue to provide really great service to the community. And a lot of people will live wonderful, healthy lives because of what we provide.
So we are a group of very passionate individuals who work really hard to help patients walk through the whole path of being taken care of in the hospital, then seen on an outpatient basis to effectively manage and treat diabetes. And these patients stay with us for multiple years, so we develop a personal relationship with them, which really helps give them empowerment to better manage and treat their diabetes.